Psychological treatments are an important part of pain management. Understanding and managing the thoughts, emotions and behaviours that accompany the discomfort can actually reduce the intensity of the pain. Watch Leigh Murray and Nataja Worsley discuss a case study to showcase how psychology can play a part in helping people to cope with their pain more effectively.
Hi, I'm Nataja and this is Leigh. We're from the psychology team at Innovate Pain Management. Today we're going to just go through some information about what chronic pain looks like in back pain, and then we're going to look at a case study of a common client story. So back pain is common. Around 4 million Australians have back pain currently, and 70 to 90% of all people will have back pain at some point in their lives. So if you or a loved one has back pain, you're not alone. Lower back pain is often caused by injury and or wear and tear. Most people experience low back pain as acute, which is pain that lasts around 6 to 12 weeks. However, some people with back pain have chronic back pain. And chronic pain is pain that lasts past normal tissue healing time, around 3 months. Now, the average length of chronic pain we see at Innovate is actually 3 to 5 years. And this is a really long time to be living in pain, and it's understandable that it significantly contributes to anxiety, depression, sleep disturbance, poor quality of life, sometimes disability, and a whole lot of money and time spent on healthcare.
So while acute pain is often managed by rest and passive treatments, when pain becomes chronic, treatment approaches need to be modified. So instead of complete rest, activity and exercise is helpful for chronic pain if it's thoughtful and well-paced. Many studies show benefits of activity and exercise in managing chronic pain, such as improved quality of life, mental health, and physical functioning, including a reduction in severity of the pain itself. Different brain systems influence our experience of pain, including the limbic system responsible for emotions and the prefrontal cortex responsible for thinking and attention. Therefore, we can utilise our thoughts, feelings, and attention to better manage pain. As psychologists working with pain, we work in a holistic framework, so we see you as a whole person that is in pain. Pain affects our bodies, our minds, our close relationships, and our broader social networks, our families, schools, sports teams, and community groups.
We're going to present a case study of a female client with lower back pain, considering the biological, psychological, and social concerns, and then look at treatments. We'll call her Mary. So Mary doesn't represent a specific person or client, but she's based on common client stories that we see, and we hope that if you're a person living with chronic back pain, that you'll relate to some of Mary's story. So Mary's a 48-year-old woman with a history of lower back pain. She's married, living with her husband and 3 children. Prior to the injury, she worked as full-time as an assistant in nursing in an aged care setting. She enjoys gardening, and she's still doing a little bit of that, but not nearly as much as she did previously. She also previously lived a very active lifestyle, going to the gym and walking with her friends. So when Mary came in, she seemed really tired, fatigued, and she sat uncomfortably in her chair. She reported that the back pain occurred suddenly after bending forward to help a patient dress. And that was around 12 months ago. So she went to the doctor when the pain continued for more than 2 weeks and followed the advice to rest, apply heat, take medications. Unfortunately, that didn't help, and she then needed 3 months off work, and she trialled in the meantime various medications. She has now returned to work, but with modified duties and reduced shifts down to 3 shifts per week. And recently she's been finding she's taking more sick days than ever, and yeah, she's been struggling with this back pain for around 12 months now. So Leigh, I was wondering if I let you know some of her concerns, that we could work out how to help Mary.
Yes. So I guess it would be important to really think about the main concerns here. How is pain affecting Mary's life?
She said that it's worse than ever, and particular movements like bending and twisting make it worse. She's finding it difficult to stick with her modified duties because she feels like a burden. She doesn't want to ask for help at work. And she also feels bad about working fewer hours, like she's letting her colleagues down. She's having trouble sleeping, and that's making her grumpy and irritated and at work, but also with her family. She's gained weight, which she says is because she's stopped going to the gym, and she's really stopped walking with her friends. She said she's sad, she's feeling anxious, and she described herself as useless, actually. Yeah. She's also worried that she's going to end up like her mum, who she said had terrible back pain, and that, she said, wrecked her mum's life. She just really wants somebody to fix her back pain so she can get back to normal.
Yeah. Okay, so how is Mary trying to cope?
Well, she's in the garden. She's trying to do stuff there. That's also difficult for her though too, because she's comparing to what she used to do. She said she's also drinking more alcohol than she'd like to. She's seeing her GP a lot to try and find a solution. So she's really, trying to fix things. She's pushing through the pain, it seems, and then she's unable to do much the next day. So she pushes hard at work and then can't do anything at home the next day. And she takes her medication for pain and for sleep when it all feels too much. Yeah.
So how is it affecting her work?
Well, she's not doing as much as she used to. She's trying to avoid the movements that aggravate the pain, but that's tricky in her job. She's then more irritable because she's frustrated. She's then pushing, like I mentioned before, she's pushing through the pain and crashing when she gets home. And she's now starting to really worry that she's not going to be able to continue working.
And what about personal relationships? How is it affecting her relationships at home and with her friends?
Well, they're becoming concerned apparently, saying that she's, and she says too that she's avoiding social activities, family events. She said her husband and her kids are saying she's snappy and she's not talking very much anymore. And she says personally she's actually avoiding people and talking to them about her pain because she doesn't want to feel like a burden, and she thinks they're pretty fed up with her now. Yeah. So, yeah, I guess, at this point we need to kind of help Mary. So how might we do that?
Yeah. So it sounds like from what you're saying, Nataja, about Mary, she's showing signs of physically pushing through her pain to get things done.
Yeah.
And then she's unable to function afterwards. Her husband and her kids report she's been snappier and harder to talk to. She is showing some signs of positive coping, spending time in the garden, but she's also comparing herself with the past and what she used to be able to do. And that kind of comparison can bring down our moods.
Yeah.
There are signs of negative thinking patterns that may be worsening anxiety and depression and her ability to manage pain. You mentioned she is using alcohol to manage her stress levels, but this is likely to be contributing to her low mood and sleep problems. Of course, when any of us don't sleep well, we're more irritable, anxious, and over time depressed. We understand from research that when people are more stressed, irritable, and sleep deprived, it is harder for them to cope with pain. You said Mary had stopped attending the gym and walking with friends, which were likely important social outlets as well as physical activity.
That's right.
You mentioned she crashes after work, but it sounds like she's feeling guilty about letting others down and avoiding contact with them then. So Mary seems to be holding back, asking for help at work because she doesn't like feeling dependent on others. My guess is that feeling guilty and avoiding those activities may be triggering her to drink more alcohol, and in turn this might be worsening her depression and, as before, impacting her sleep and relationships. Her weight gain may also be influencing her self-image.
Yeah, I think that's right. Yeah. So, given all this stuff and our thinking around what's going on for Mary, how can we help?
So with psychological support, it would be firstly important to collaborate with Mary about what her goals are.
Yeah.
Mary might want to focus on sleep, and therefore we'd do some education about sleep and also establishing a good fit nighttime routine. We'd look at daily activity planning and pacing strategies, also possibly health behaviour change for her alcohol use.
Yeah.
We would work on cognitive and behavioural strategies, helping her to manage anxiety and mood symptoms, such as monitoring her thoughts, feelings and behaviour.
Yep.
Communication skills training and relationship support may benefit Mary and her family. Finally, relaxation and mindfulness skills may offer positive ways of coping for Mary.
Yeah, okay. So what are your main concerns?
Yeah, so although Mary is working, I'm concerned that she isn't managing her pain effectively throughout the day. Also, she seems to be socially isolating herself. So in her case, she would benefit from seeing a psychologist in a multidisciplinary team.
Oh, so what does that look like, a multidisciplinary team?
So as part of the team, a psychologist would also work with a pain specialist to optimise their medical interventions and a pain physiotherapist who would help Mary build her understanding of limits and pacing and rebuild her confidence with movement. In Mary's case, too, a group program could be really helpful. Many clients state knowing that they're not alone in managing pain is particularly helpful. So these services are ones that we provide at Innovate Pain Management. We do individual counselling and psychological support, as well as an intensive group pain program.
Thanks, Leigh.